doctor on that very subject. It says this is just what, well, the doctor ordered, and welcomes this development on the part of Amazon, JPMorgan Chase, and Berkshire Hathaway. Dr. Jeanette Neshawat joins us right now. Doctor, you like this. Why?
I do. I think this is huge. It's monumental. I'm excited because anything that can have a positive impact in the lives of my patients, I am all for it. I mean, you've got three huge corporations coming together to provide health care, not just for their employees, but for their families. That's got to be over 1 million people. But my concern as a doctor is that I want to make sure, I hope, that the care that is provided to them is good quality care and it's affordable. And on top of that, we want to make sure that patients can access it easily. You know, we wonder, why do patients always go to the ER for things that are not emergent? It's because they call their primary care doctor and they can't get in for 2 to 3 weeks. You can't wait 2 to 3 weeks if you have strep throat or a UTI or pneumonia. You got to be treated in a timely fashion.
No doubt. But sometimes, though, Doctor, I wonder whether you should worry about this, though, because whatever you hope for could come to reality. These are companies all very bottom line oriented, all very big at excess expensing and all of that. Now, that's rampant, certainly in the healthcare industry. Some are fearing that this sort of private company alternative to dealing with medical, ailments and the costs therein. A lot of these companies are addressing their own rocketing healthcare costs, that they could even be tougher. What do you think?
Well, you know what? I'm going to have to say I don't agree because, Neil, you know, one of the statements that they said was this will be an initiative that is free from profit-making incentives and constraints. That's why I like it so much. And if they're already billionaires. I mean, Warren Buffett, he's a billionaire. Is he really out to make an extra buck? If you keep your patients, your employees healthy and happy, they're going to work harder for you. You know, Richard Branson, one of the best advice he ever gave, take care of your employees. So I think it's a step in the right direction. And look, everything else is already failing. The ACA is failing. Costs are astronomical. And, you know, patients right now, they can't afford their premiums, their deductibles, their copays. And it's just a disaster right now. And we don't know what the future holds with Medicaid and Medicare. It may go bankrupt. And then with the ACA as well. So I think it's good that they're being proactive, taking initiative, and trying to do something to benefit their employees.
If I could switch gears a little bit, Doctor, but I mean, much has been written about this particularly virulent flu season.
Yes.
The record number of deaths among young people, I guess, is something that we typically don't see. What's going on? What can you tell us? What do we do? That sort of thing.
The rise of the flu and the impact that it has on my patients. I saw 47 patients yesterday. About 30 of them I diagnosed with either influenza A or influenza B. Some of them had asthma. Some of them were pregnant. And it was so important for me to treat them immediately because some are at higher risk of complications. For example, many of my patients who had asthma, and they tell me they didn't get their flu shots. And I had to kindly counsel and educate them. You're at a higher risk of complications, especially if you have asthma. You don't get your flu shot, you end up catching the flu. Or if you're pregnant, you're at a higher risk of catching the flu. It's just wild. It's rampant right now. It's spreading like wildfire. And the most important things that we can do to protect ourselves, number one, get your flu shot. It doesn't matter if it's 10% effective or 30% effective.
So it's not too late to do that? You can still do that?
Absolutely not. Okay. I'm still administering the flu shot where I work right now. But also, in addition to the flu shot, keep your hands washed and clean, stay hydrated, avoid rubbing your eyes, avoid rubbing your nose, get plenty of rest, and make sure you're getting a good, well-balanced diet.
Wow, 47 patients in one day. You are a busy doctor. All right, thank you very much,
Doctor. Patients. It's my pleasure. Good to see you, Neil.
Good for you. Thank you, Doctor, very, very much.